Ciao mondo, hello world, hola mundo, hello mom, konnichiwa, ni hao, namaste. We are here today with Professor Federico Alberici from Brescia, Italy, at the Italian Society of Nephrology, where he just gave a very interesting lecture on nephroprotection. Can you just tell us the summary of your presentation, please?
Yes, thanks, Claudio. Well, nephroprotection has been something as nephrologists we have to deal with on a daily basis. Up to a few years ago, RAS inhibitors were the main weapons to deal with these things. But things now are changing. We have new drugs, we have new therapeutic options that are facing the market, and that we need to know and we need to be able to employ. Among these, SGLT2 inhibitors are probably the most interesting one.
Do you want to spell out what SGLT2 is?
SGLT2 are a class of drugs that are able to inhibit the reabsorption of sodium and glucose at the proximal level of our tubules, of our kidneys. These induce glycosuria and a natriuresis that lead to a stimulus of the tubulo-glomerular feedback and to a constriction of the afferent arteries.
So at the glomerular level, there is a hemodynamic effect, which is reduced proteinuria and probably reduced hyperfiltration, leading to nephroprotection. Do you envisage other mechanisms?
Well, the mechanisms are probably more complicated than this. Of course, these are the most rapid one and the ones that gives an immediate benefit of using the drugs, but probably we have benefits also in terms of anti-inflammatory effects, antioxidant effects that may help in using the drugs also in other contexts.
A couple of studies that you suggest to our young fellows following the YouTube channel.
Well, for sure, the most revolutionary one is the DAPA-CKD trial. This trial involved not only diabetic patients, where we know that this class of drug is working nicely, but also patients with CKD without diabetes. And in this context, it has been shown that the drugs have a significant benefit in terms of reducing the risk of renal outcomes and in improving the prognosis of our patients.
Independently on the control of glucose and independently on the level of GFR.
Exactly, that's amazing.
Excellent. So thank you very much for following our Cappuccino today from Rimini in Italy at the Italian Society of Nephrology meeting with Federico Alberici and myself. Thank you very much.
Thanks.
Excellent.
Excellent indeed.